I'm sure I'm not the only person that's noticed that there are so many rules when it comes to pregnancy. It's easy to become super hyper-focused and think that you may only have your OB or midwife to support you during your pregnancy. But the truth is that there are tons of different healthcare practitioners out there who can support you in having a safe and healthy pregnancy in addition to your OB and midwife. So if you're ready to find out who those practitioners are, what they do, why they benefit you, then click that like button and let's go. Okay, so the first practitioner on the list is a chiropractor. There are tons of benefits overall for seeing a chiropractor, but seeing one regularly during pregnancy helps with things like sciatica, low back pain, stiff neck and muscles, headaches, tension headaches, migraines, and also if you are a mama who is experiencing pelvic pain. It's also been said that chiropractic can help to turn breech babies because they are basically manipulating, for lack of a better word, your body, and it's making more room in the womb for the baby to actually turn and get into the ideal position for delivery. Rumor is that seeing a chiropractor can also help to reduce the amount of time that you're in labor. I don't know how that's proven, not even gonna lie, but I am kind of excited that it might be a truth. One of the main reasons that chiropractic is so beneficial for you while you're pregnant is because our spine has so many different associations. Like, for example, this vertebrae helps with nausea and morning sickness. These vertebrae correspond to the chakras and the whole energetic field of your body. This one helps with nasal congestion. This one helps with headaches and migraines. So it's more than just going to someone to crack your back and hope that you feel better. There's actually correlations between your spine / your vertebrae and other parts of your body. The second practitioner on this list is an osteopath. If you are someone who maybe chiropractic freaks you out, you have no desire to have your back cracked or your neck cracked, or just it's not your thing, that's totally fine. Osteopath is very hard to explain if you haven't done it before, but I'm going to try my best. It is in the same way that a chiropractor would manipulate your body to get cracks. An osteopath tunes into your body, but there's no cracks involved typically. There might be a small one here and there, but their sole intention is not to crack your back or your neck. If you think of it as your entire body is supposed to be, this is going to sound so weird. Let's pretend your entire body plays a song and now you have this nagging knee pain. That knee is now off tune or singing a different song. So the osteopath, what it does is he or she tunes into your body to help get your body back into the same flow and into the same rhythm. And that could look like, stretching one leg over the other. It could look like, stretching your arm above your back or your head to try and get your shoulder back into the correct placement. It's a very different methodology from chiropractor. I find it to be very gentle compared to chiropractic, especially if cracking just isn't your thing. So an osteopath, it's easy when you hear the word to just think of bones, but it's really not to do so much with bones. It's also the muscles, the fascia, the organs. It's really just trying to get everything back into place to flow into its perfect song so that you're not experiencing pain or discomfort. And similar to chiropractic, an osteopath also helps with, for example, that nagging knee pain or the headaches, the migraines, the low back pain, the pelvic pain. Pretty much all the same things that you would go see a chiropractor for, you can also see an osteopath for. Okay, the third one on the list is a physiotherapist. It is not uncommon to see a physiotherapist while you are pregnant, especially for pelvic floor exercises. Strengthening your pelvic floor not only helps strengthen your delivery muscles, but also helps with urinary incontinence and is said to make labor and delivery easier. Again, I don't really know how that's proven, but it is kind of exciting to think that that's even a thing. There are tons of exercises that a physiotherapist can recommend, or I guess assign to you, to help strengthen your pelvic floor, but not only that, to give you pregnancy-friendly strength training exercises and tips. Because let's face it, labor and delivery is probably more than just laying there and hoping that a kid slides out. It's a very physically demanding time for us. So it's very important to stay as active as you can. And even if those are low impact exercises or stretches, every little bit helps. All right, the fourth one on this list is an acupuncturist. Working with an acupuncturist can help with sleep issues, swelling, low back pain, heartburn, acid reflux, and more. I would highly recommend doing your research before booking an acupuncturist, whether it's an acupuncturist or just anyone else on this video, just to make sure that they are someone who is very comfortable working with pregnant women. Like I said at the beginning of the video, there are a lot of rules when it comes to pregnancy. And especially with acupuncture, there are certain points that shouldn't be pressed or activated during pregnancy, or should only be activated during certain times of pregnancy, during certain trimesters. So you really want to make sure that the person that you're going to see is well aware of what can and cannot happen during an acupuncture session if you are pregnant. If needles aren't really your thing, I hear you, I feel you, but I'm just going to throw it out there in case it's something that you are considering, but you're a little hesitant because you're kind of scared. Honestly, the needles don't really hurt. There's like a teensy tiny pinch or prick, and that's it. And most people find acupuncture very, very relaxing. Keep in mind that you can have an acupuncturist that is like a standalone professional, or you can have someone who has it as an add-on to their existing services. So for example, a massage therapist, a chiropractor, a naturopath. It's not uncommon for any of those to also be well trained in acupuncture and have it as an add-on service. So that actually brings me to the next profession on my list, which is a naturopath. A naturopath is technically a doctor, so they can also, request the same kind of blood work that your OB or midwife can also request for you. They do sometimes look at it through a different lens. For example, if they are looking at certain mineral levels in your system, they work with you to make sure that that mineral level is not only sufficient, but at its optimal level. And this is typically done through vitamins, supplements, certain dietary changes, etc. Since a naturopath is a doctor and their whole realm is essentially vitamins, supplements, minerals, etc., it's a great idea to have them in your back pocket, because there are so many vitamins and supplements that are not safe during pregnancy. Just because it's natural doesn't mean there aren't any contraindications, especially during pregnancy. So having that person who really knows what you can and cannot consume, what is and isn't safe for you at this, whether it's throughout the entire pregnancy or just during certain trimesters, it's really helpful to have someone like that in your back pocket that you can rely on. A naturopath can also help you to navigate, especially those early pregnancy symptoms. They're someone to talk to support you in nutritional deficiencies, and they're also there to support you both mentally and physically, and many of them are also available postpartum as well. Okay, the sixth person on this list is a traditional Chinese medicine practitioner and or herbalist. I put them in the same category, even though in some aspects they're very similar and in some aspects they're very different. Just like the other practitioners, not everyone is comfortable working with a pregnant patient. And some traditional Chinese medicine practitioners or doctors actually prefer not to either work with pregnant women or not to give them Chinese herbs while they are pregnant. So these practitioners can give you herbs to help you support different areas of your body, both physically, mentally, emotionally, whether that is sleep support or helping with acid reflux or heartburn, reducing anxiety. Their main goal is really to bring a level of homeostasis to the body, which is just a fancy word of saying full-on balance within the body. Traditional Chinese medicine practitioners especially are very focused on balancing your qi. They have a unique view of your organs. If you are experiencing these 3, 4, 5 symptoms that could be very specific to, for example, spleen issues. So they are going to work on strengthening your spleen, which will in turn also help boost your qi and balance your system. Just a word of caution: if you are torn between traditional Chinese medicine or a herbalist, in my experience, traditional Chinese medicine herbs taste absolutely terrible, and they just don't know how to taste good. So if that is something that you have a hard time doing, having tea, for example, that tastes terrible, you might want to think twice about traditional Chinese medicine. And the reason I had put them in the same bucket, the traditional Chinese medicine and the herbalist, is because in a lot of ways they're very similar in wanting to bring balance to the system and by using herbs in doing so. But the main difference is that there are herbs that are available here that your Chinese medicine practitioner may not be well versed in. For example, here we use things like raspberry leaf and yarrow, and those aren't necessarily traditional Chinese medicine herbs, where they might use very different herbs even though it has the same result, and they taste much, much worse. Okay, practitioner number 7 is a registered massage therapist. And I kind of feel like everyone at this point knows the benefits of massage, but just in case you don't, or just in case baby brain is kicking in and you literally can't remember anything about massage therapy, some main benefits are relief for heartburn, low back pain, pelvic pain, helps with sleep issues, and helps to reduce overall stress and anxiety and just bring an entire sense of relaxation to your body. Now, a lot of people think that once they become pregnant that they actually can't go for massage anymore, but that's not true. I would recommend looking for a massage therapist who specializes in pregnancy or prenatal massage, and the reason I say that is because there are actually pregnancy pillows that you can get that sit on top of your massage table, and there's actually a big indent in it to fit your belly in there so that you can still lay face down safely and comfortably and still experience a very nice, relaxing, very beneficial massage. Another option, if your massage therapist doesn't have one of those pregnancy pillows, is I have heard of people going for their massage appointment and they've just been asked to lay on their side, and the massage therapist works on their back and shoulders, and then they flip over and lay on their other side. So it's really just a matter of personal preference, I think. You would still get the same amount of benefits regardless of whether you are on your side or whether you are face down in a pregnancy pillow. Bonus points if your massage therapist is, or if you also go see a Reiki practitioner. And the reason I say that is because on an energetic level, it will help to reduce any blockages, help with any pain relief, stress relief, anxiety. Just keep in mind that it is an energy. So just because you want Reiki doesn't mean baby wants Reiki. And they will make it very known to you if they do not want to participate in that Reiki session. Okay, the final practitioner on this list is a therapist. I did mention in a previous video that I think everybody should go to therapy because we all got our problems. And pregnancy is a lot. Pregnancy is like a pretty serious mental game. From having to deal with body image issues to realizing that you are suddenly now going to become a parent and life doesn't look remotely similar to what it did 6 months ago even. There's, I think, a lot to talk through, a lot to mentally prepare yourself through. mentally prepare yourself for. So I wanted to also make sure that I threw in some emotional, mental benefit as well, in addition to having physical relief by seeing other practitioners. Don't forget that being healthy doesn't just mean being physically healthy. You should be also looking at the mental, the physical, the spiritual, the emotional levels of your body as well. Don't forget to let us know in the comments if you have seen one of these practitioners during pregnancy, or if there's someone that I completely missed and you think is an absolute lifesaver and we should all be seeing one during pregnancy. Also, I would really love if you could hit that like button before you head over to the next video. Thanks for watching, and I'll catch you guys over there. Bye.